invite to our conference this morning. This year's theme for our 2022 conference is Centering Resistance, Imaginings of a New Feminist Future. And the event is co-convened by my office, the Women's and Gender Studies Consortium, and the Office of the Gender and Women's Studies Librarian. Both of these offices are statewide offices that support women's and gender and sexuality studies across all 13 UW system campuses. And both of our offices have been a fixture across UW system, supporting courses and programming since the late 1970s. And we're super delighted to have everybody here today in the virtual mode to join us. For this session, we're utilizing CART captioning, which is the Access Real-Time Translation Services. And we have it set up with the Zoom enabled captioning. So you will see what you're seeing right now. If you've clicked on the closed captioning is the live translation. And thank you very much to Captioner Kelly for supporting all of our sessions. And if you have any technical issues or need assistance, please use the chat or raise your hand during this session. However, for the Q&A at the end, we really ask you to use this Q&A box because that's the best way to communicate with panelists and pose questions. So if they say something during one of their talks that you want to hear more about, go ahead and throw it in the Q&A. And at the end, we'll have a facilitated session where you can use that method to interact with our panelists today. I'm going to hand things off to Carla Strand, the Gender and Women's Studies Librarian, who is going to offer some comments on land acknowledgements in the statement that we've created for this conference today.
Good morning, everyone. Thank you, Stephanie. We are going to cross our fingers that for the next minute or so, my dogs will not be barking. Apologies in advance. My name is Carla Strand, she, her. I'm the Gender and Women's Studies Librarian for the UW system. And you may also be familiar with my columns at Ms. Magazine. I'm a queer white settler with long brown hair and glasses, and I come to you today from my home office, which occupies stolen Potawatomi land. We wanted to take a moment to honor the Indigenous peoples who care for the land on which we are located, and we ask you to do the same. We are grateful for the Indigenous and ally labor that went into creating UW-Madison's land acknowledgement, and we also understand that institutional land acknowledgements are limited and have been deeply inadequate responses to the erasure, violence, and legacy of trauma brought on by settler colonialism. With this, we wanted to begin this session with an abbreviated version of Madison's land acknowledgement and then share just some thoughts that are the result of our own critical thinking about this practice. So the University of Wisconsin-Madison is a land grab institution that occupies ancestral Ho-Chunk land, a place their nation calls Des-Jope. The Ho-Chunk were forced to cede this territory in 1832 and survived decades of ethnic cleansing when both the federal and state governments repeatedly, but unsuccessfully, sought to forcibly remove them from Wisconsin. We honor the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. As white settlers, we acknowledge the violence, dispossession, removal, erasure, and genocide that led to the colonization of the land, the attempted destruction of communities and lifeways, as well as the enslavement of millions upon whose forced labor this country was built. Since our conference is taking place virtually, we consider also the legacy of colonization embedded within the technology that we're using, which remains unavailable in many Indigenous communities. That's made also from materials extracted from the land that contributes to changing climates disproportionately affecting Indigenous peoples worldwide. We acknowledge the unearned benefits we receive from these continued systemic oppressions. We are committed to individual and collective action to disrupt this system in support of the full sovereignty of Native peoples, as well as the restoration of stolen land and resources, cultures, languages, and histories of Indigenous, Black, and other people of the global majority who continue to live, learn, work, and thrive on these lands. So we encourage you to take a look at the link that is dropped in the chat right now, which is a bibliography that we've created called From Land Acknowledgement to Action. There's resources there that can help you begin to investigate whose land you occupy, and also looking at Indigenous critiques of land acknowledgement and provide some resources for you, most importantly, to take action. Thank you.
Thank you, Carla. It is now my honor to introduce this morning's plenary, the African American Health Network of Dane County. The African American Health Network is a longstanding supporter and participant in this annual conference. And we're always really delighted to welcome them to our Saturday opening plenary. I sent out an email earlier today, and the Saturday portion of our conference is really an opportunity for us to engage with community partners across Wisconsin and beyond, and to recognize the overlap of our work with all of the different facets of community work and engagement that's happening. So the African American Health Network initially was established to provide African American health professionals with a community to engage with, share information, and provide support for one another. Today, the network has 4 core functions: research, advocacy, leadership, and education. The network acts as an agent for the African American community in interfacing with the broader community in general and the health community in particular, especially as it relates to African American health problems. The network seeks to decrease the health disparities that ravish the African American community by providing practical yet powerful informational tools that will inspire, equip, and energize African Americans to improve the overall health and wellness of themselves and their family. I will now pass things off to Dr. Eva Vivian, who is a professor in the UW-Madison School of Pharmacy and chair of the African American Health Network, who will introduce our panel today. So welcome, Dr. Vivian.
Technology, I have to unmute. Welcome, everyone. Thank you for spending your Saturday morning with us. It's really a pleasure to be engaged in this program every year. I am very proud of the efforts of our members of the African American Health Network that make positive contributions that benefit all of society. And we really look forward to having more opportunities to work with community partners in order to make a positive impact on the lives of as many people as we can touch. With the support and contribution of parents, civic leaders, community partners, and corporate sponsors, we are striving to fulfill our mission to enhance the lives of African American families and their communities here in Dane County. Now, the African American Health Network was initially established in the late 90s to provide African American health professionals with a community to engage with, to share information, and provide support for each other. Today, the network, as you just heard, has 4 core functions: research, advocacy, leadership, and education. Today, I have the distinct pleasure of introducing our moderator, Gail Johnson. Now, Gail Johnson has been the director of the Wisconsin Well Women's Program in the Department of Health Services for more than 20 years. This statewide program is Wisconsin's component of the National Breast and Cervical Cancer Early Detection Program, administered by the Centers of Disease Control and Prevention. Ms. Johnson is a past chair of the CDC Council for Breast and Cervical Cancer Prevention and Control. And as many of you may be aware, African American women are less likely to receive annual mammograms compared to non-Hispanic white women. So we really have our work cut out for us. And Dr. Johnson has been a leader in this activity. For 3 years, she was also a member of the CDC's National Breast and Cervical Cancer Early Detection and Control Advisory Committee. For many years, Ms. Johnson has been a very active member of the Wisconsin Women's of Color Network. She's also been a member of the African American Health Network of Dane County since its inception. Recognizing the importance of women living long, healthy lives. Ms. Johnson has coordinated healthcare programs for both organizations across our state and in many states across our nation. So with that, I'd like all of you to join me in welcoming Gail Johnson as our moderator.
Good morning, and thank you so much, Dr. Vivian. And it is always a pleasure to be a part of this particular conference. But I will admit, I long for the days for when we were in person. It's just nice to be able to hug folks and shake hands and, just have those little side conversations. But we're gonna, go on with our virtual program today, and I hope that all of you get something out of it. As Dr. Vivian indicated, I have been with the African American Health Network since its inception in 2003. And I am most proud of the fact that, first of all, we've been around for 19 years. And secondly, not only have we been around for 19 years, but we've been able to do some interesting things in the community. And one of the things before we get started with our panel is and I think some of you may have been a part of this, but on January 29th of this year, we, the African American Health Network, we kicked off our Black History Month celebration with a program, Be Black, Be Strong, because we know in order to be Black and to really, really, really enjoy life, because one of the things that we say as part of the health network is that health is our greatest wealth. And so we have to be strong. And so one of the things that we did with our program, obviously we talked about Black historical figures, especially those who made contributions to health and medicine. But the other thing that we did was that we were able to share important health messages with the community. And I should let you all know, for those of you who were not a part of this particular program, Dr. Vivian did a wonderful job talking about COVID-19. And that's kind of where we are now. I mean, 2.5 years in, who would have, as they say, as they used to say in the old days, who would have thunk it? Not who would have thought it, who would have thunk it? But we're 2.5 years into this pandemic. I am hoping that we are on the downside. I will tell you one more thing before I introduce our panelists. I was the one, the day that Governor Evers gave the order for everybody to go home and work remotely, I was the one that stood in the hallway in the health department and said, oh, we'll be back in a few months. And I actually had a smile on my face, because none of us could have imagined that the COVID-19 pandemic would go on, past 2020. Here we are now, we are making the best of it. And again, this morning we're having our conference. And so let me introduce our two wonderful panels. First of all, Carla Gaines, or Carla Peterson Gaines, as she calls herself, really needs no introduction for a lot of people. But for those of you who don't know her, let me say that Carla has worked for Quartz and the UW for 28 years. And she works with Medicaid families, advocating and creating programs that would support their health and assist in removing barriers to healthcare, which is very important. She is also the Community Research Associate with the University of Wisconsin School of Pharmacy and the Community Academic Aging Resource Network. She works closely with our own Dr. Eva Vivian, and you all know that, of course, Dr. Vivian is with the School of Pharmacy. Her work is to improve equity across the state and building partnerships between health systems, the UW, and most importantly, the community. Carla serves on many boards and she has received numerous community awards. She is a wife, she's the mother of 3 grown children, and the grandmother, and I love this, of 4 beautiful legacies. Carla states all the time, and you can see this in her, my passion is helping my community reach a place of health equity that they deserve. Yay, Carla. Carla, I'm going to turn it over to you.
Thank you so much, Gail. And thank you, Stephanie, and to the entire committee for this opportunity, to Dr. Eva Vivian for the invite, and to my sister Dina, look forward to your presentation, and to Gail Johnson, my long dear friend. And so as Gail mentioned earlier, the COVID-19 virus has been with us. And today my presentation is going to really talk about that piece of partnership and where we are and how we really began to maneuver community in addressing COVID-19. So I'm going to share my screen. And I'm gonna make sure my sound is good. And stop. As Dr. Eva says, technology. So I want to make sure I get it from the beginning here. From the beginning, please. And it's still not doing it, so. All right, can everyone, oh, cool. I'm quite sure the audience can see my screen. Thank you, Dr. Gail, for helping me with that. And so again, I would like to thank you all for the opportunity just to come and share with you all what we learned as a community in dealing with COVID-19. As we all know, COVID-19 really became on the scene here in the United States, really shutting down the nation around March 20th, 2020. And I'll never forget the day. My husband had a conference and they emailed him and said the conference is canceled. And we said, well, honey, let's just go to Chicago anyway. Well, as soon as we got back, things were shut down, offices were closed, like Gail said, and we all began to work from home. With that, 80 million people since then have passed from that, has contracted COVID-19, and almost 1 million have died. And what COVID really exposed was the inequities in the health system as it relates to Black people. It uncovered structural and systemic racism that we have seen in our country for over 400 years. And so today, we are going to talk about how do we build the pieces of health systems, community, organizations with trusted resources in order to get the message out. And all right. And for our agenda this morning, how do we really create those partnerships? It's important that we will be talking about engagement with the public health department, how the tools of social media and education, partnering with faith-based organizations, of course, partnering with our very own trusted organization, the African American Health Network, and other health systems and HMOs. So this slide really shows you how we connected with public health department. As you know, in the beginning of COVID, and when I was doing my research for this, I really had to go back to really think about all the miscommunication, how this virus was still evolving. We didn't know, should we wear masks, no masks, surgical masks, cloth masks, just went, really, how do we mitigate? How do we begin to slow this virus down? So we know every day it was evolving. Still today, with BA2, with new variants, with mutations, we know that COVID is still evolving. And so these were some of the social media campaigns that we connected with public health. It was important that we engage with the public health department as being a trusted source of information. However, how does this information get to the community so that we can tweak it to get it out to our community so they can embrace really what's going on? So we know, stay away from those closed spaces, crowded places, and no close contacts with individuals. And when you, as we know, also we saw that COVID-19 affected, when we talk about the deaths, we know that 2 out of 4 of those deaths were of Black people. And so we were 2 times the rate of death in our community. Our community didn't have the luxury sometimes of social distancing in families. Sometimes there were several families living in one household. We know that many of our Black families were the McDonald's workers, the grocery store, the most essential workers that they called essential, but wouldn't give them the supplies to do the essential work. And so we saw our community really dying. And so educating and really, what does that mean when you say social distancing? Well, for a family in that type of complex, we had to use different terminology. We had to say, wear a mask, as you see on the green slide. When do you need to wear a mask? And so we began to share with families that you should wear a mask all the time. Now, mind you, this was before vaccines came about. So we didn't know about vaccines yet in the early 2020s. And so again, working with the public health departments, key, getting the message out of how to stay safe within our community is what we did with trusted individuals. This is, as you can see me, Gail mentioned that I work for UW Health in Quartz. Again, bringing back to your memory, testing was very hard to get. You had to be deathly ill in order to go to the hospital to get a test, because the reagents weren't right. There was only one lab in Atlanta that was working. And so we as a community were very afraid and very frightened regarding if I got COVID and couldn't go to the hospital. Even if I had COVID and no symptoms, I couldn't go to the hospital to get tested, because the hospital said, if you do not have any symptoms, if you don't have a fever, if you don't have a cough, just stay home. But our people were dying. And in order to know if you had COVID, you had to get a test. So this was one of the social media campaigns that I did for UW Health as a trusted source in the community to help share this information regarding, if you have these symptoms, what do you do? How can you get a test? Where can you go? Another piece, when we finally got testing, we did testing here at the Alliant Energy Center. You see the picture on it's my left. I don't know if it's on your right, but I said that, you know what, I'm going to go Facebook Live so my community could see how testing was really done. And so as you can see in that slide to the left, that's my husband getting tested. And I had to bust those myths. Oh, they're gonna take your eye out. Oh, they're gonna go take the swab up so high, I'm not gonna be able to see, my eyes gonna be gone. They're gonna put a chip in it. And I'm besides, before the vaccine was out, they were talking about ways that the testing was going to be wrong, and they're going to give you COVID through the testing. And so again, we are visual people, showing my people that this is how it's done. I'm okay. I still have all my eyeballs. Everything is still good. And so please come out, get tested, because if you didn't get tested, you didn't know if you had it. And that's how that virus is beginning to spread and spread and spread. And so what we also did was we connected with Mount Zion Baptist Church, one of the largest churches, Black churches in Madison. And we did a 2-day drive-through COVID testing right in our parking lot. We had, again, partnered with Public Health Department. They brought all the equipment. They brought all the testing equipment. They signed up people, got their emails, and they were able to find out their test results within at least 2 to 3 days. And so again, building trust within the community, moving from the Alliant Energy site. I don't know if you are familiar with Madison. We may have a large national audience, but that site is not in the heart of the Black community. So bringing the testing site in our community was important. Getting the word out, walking the neighborhoods, telling people to come get tested, saying it's gonna be safe. Those are the types of things that we needed to do so we can find out in those early days, still the 2020, if you had COVID. So again, partnering with faith-based organizations. Mount Zion Baptist Church was one of the first entities that had a panel that brought together a panel of health systems to talk about the vaccine. And at that time, Pfizer was the only one out. And how Moderna hadn't gotten approval yet, but it was on its trail. But on this picture, you will see the pastor, the public health department, UW health scientists. You will see SSSM's vice president, Mr. Boatwright. And also you'll see UW Health Shiva Bidar, who's very well connected to our Latinx community. And we wanted to bring experts to the table in a COVID environment. As you can see, there's social distancing with masks on. No one was in this building but them and myself, because again, this was now January of 2021. And we wanted to inform. We had it on Zoom and we had it on Facebook Live. Matter of fact, Dina Wright and her constituents of faithful older adults that she serves were on that committee, because on that meeting, they had much questions to ask. And Dina is a trusted source in her community, in that community. So having Dina there asking questions was huge for this project. This again is the pictures seen from all the health systems, UW Health, SSM Health. We had Unity Point Meritor, Madison-Dane County Public Health Department, Quartz Health Solution, and Mount Zion. Again, partnership, partnership, partnership. I can't say that enough about collaborating with partners so that they can hear the Black narrative. So it's important that we share our narrative with them so that they can address our issues, because we are clearly very important. So besides having testing sites, we moved on a little further. Once there was the vaccines that came out, we had COVID and flu vaccine clinics. And to date, we have had about a total of 6 clinics throughout our church, not only serving our church, but again, we're in the heart of the South Side, in the heart of the Black and Brown community, in the heart of walking distance, right there. And so we were able to, again, partner with public health and partner with these other entities. And so we could have a successful vaccine clinic. We also gave out gift cards, and we also gave out KN95 masks, because if you can remember, again, 2020 and 2021, those masks were hard to come by. And so we wanted to make sure that our community was being safe. And I love this picture because it displays all of us today are on the African American Health Network. And you've met our leader. She rebirthed the network, and DHS gave the network a grant, again, working with populations that serve the people. And we did a COVID-19 vaccination site at the Goodman Community Center. And there is our own very Dr. Eva Vivian in that orange mask, drawing up medication. We know she is a pharmacist, been at the School of Pharmacy, I think almost 19 years, if I'm not mistaken. Is that right, Dr. Eva?
Close, 16 years.
Oh, so okay, well, look. And so she was right there in the community, trusted in the community. She is a researcher that is trusted, that does work in the community. Everybody knows Dr. Eva. Everybody trusts her. So when they say Dr. Eva is going to be here, African American Health Network is going to be here, let's come out. Now, it was hard. I won't say that all of these steps were easy because our community needed education. Sometimes they just needed a talk. Sometimes they just needed to be, well, why is this? I heard that if I get the vaccine, I'm going to have a magnet in my arm and they're going to track me. No, we wanted to bust all of those myths and bring them facts. So sometimes Dr. Eva would just do listening sessions and come out and come ask me questions. And so again, education, persuasion, and trust, critical in order to move the dial with COVID-19. And this is my last slide. And this is what Quartz did in regards to our community partnership in getting the message out. Not only did we do email blasts with our Black members in the effects of COVID, how you can contract it, but we also wanted to do something that addressed the community. As Gail said, I worked with the poor and underserved, the most vulnerable in our community, the Medicaid members. Wanted to make sure, how can I get to these testing sites? Is there free transportation for me? So yes, all of those things are available. And so before I close, I just want to show you this video and I'm hoping that you can hear it. I did do the sound earlier, so let's see. Here we go. As someone who was out in the community nearly every day, representing Quartz and caring for our members, I get asked a lot of questions about COVID-19 vaccines. What I'm hearing is, are they effective? Are they safe? Some worry about how fast the vaccines were developed. These are very good questions, and it makes sense. So let's talk about it. According to the Centers of Disease Control and Prevention, these vaccines are highly effective at preventing COVID-19. They can keep you from getting seriously ill, even if you do get COVID. And these vaccines are monitored intensely for safety. Still, some people are saying, I'm going to wait and see what happens. As someone who cares about you, your families, and our communities, I am asking you, please don't wait. With new, more contagious variants spreading, the time to get vaccinated is now. I got mine in February. I ask you to please get yours. The vaccine is free. You will help protect yourself, your family, and our communities. If you still have questions about the vaccine, reach out to your provider. What is the most important question people ask about the COVID-19 vaccine? Where can I get mine? Quartz has put together information on how and where to get your vaccine. Together, we can help put an end to this pandemic. Thank you. Well, thank you all so much for joining in my presentation on today. And if there are any questions, I don't know, Gail, if you want to take questions now or after Dina presents,
We'll take questions after Dina presents.
All right. Well, thank you for listening. And I look forward to my sister Dina in our presentation. I will stop sharing my screen. And thank you all for having me and understanding how important partnerships, community partnerships with trusted individuals will help communities of color, especially Black communities, still continue to fight and educate this deadly disease. Thank you.
Carla, thank you so much. You talk about the importance of working with the community. So I'm going to add one thing to that. And this is something that I've told a number of people recently. We all benefit from education. And by that, I mean the messenger benefits, because if the messenger takes the time to listen and to respond to questions that folks have, the messenger will learn something. Like you said, you know, now you can tell us some of the key questions that you heard as you were going out talking about the importance of the vaccination. The folks who ask the questions benefit from the education because they have the opportunity to talk with a trusted member of the community and ask their questions. And here's the other thing I say, no question is too simple, too foolish, or too stupid. This is how we learn. So thank you so very much. I am very proud to introduce Dina Wright, who is a Madison native. And this is where I'm kind of a little jealous because she's an award-winning radio personality and TV journalist. Yay! She considers it a blessing to have graced the airwaves in several major media markets. Listen to this, including Los Angeles, Philadelphia, and the Big Apple, New York City, for more than 2 decades. She has interviewed Hollywood celebrities, national recording artists, and political figures. And wait a minute, you interviewed, former President Barack Obama. Okay, we need to talk. Okay, all right. Dina is currently serving older adults in Dane County as Newbridge Madison's Diversity and Inclusion Manager, where she is intentionally committed to health education, addressing racial disparities and inequities in health, promoting joyful aging, and providing social engagement for Black and Spanish-speaking older adults. She is a lifelong member of Mount Zion Baptist Church, and of course, a member of our African American Health Network, the African American Opioid Coalition, the Dane County Caregiver Advisory Board, and the Society for Professional Journalists, as well as the National Association of Black Journalists and Women in Focus. Dina is a proud parent of 2 adult children, and her granddaughter, Allie, fills her life with endless joy. And her granddaughter is 11 years old. Dina, take it away.
Thank you so much, Gail. Thank you to my other panelists, Carla Gaines, and also to our wonderful president, Dr. Eva Vivian. And thank you to the UW for inviting us and helping me to be a part of this for the first time. It's very, very humbling. Thank you so much. I too am going to try to struggle with sharing my screen. Let's see here. Let's see. Okay. Okay, can everybody see that?
Yes.
All right.
Let's
just pray that it works here. Do you see it, the screen still there?
Yes.
Okay. Let me just go out of here, get this off the screen. Okay. All righty. So I'm here actually to share with you some of the wonderful work that is done by an organization that I have recently joined over the past couple of years called Newbridge. We are one organization with 3 locations. We have a North Side office in Madison, an East Side office, and also a West Side office. Our goal is to provide a connection to successful aging. And what does that mean? Of course, that can mean different things to different people, but I like to break that down into 4 categories: a low probability of disease and disease-related disability, high cognitive and physical functional capacity, emotional vitality, and number 4, being actively engaged with life. And we know as we age, we really hope that we will have all 4, right? But certainly having 1 or 2 is indeed a blessing. And we provide supportive services needed to help older adults live independently and to stay in their homes. And we really strive to empower older adults and give them dignity, which is really important, the dignity that they deserve. And we encourage them to be active participants in every aspect of their lives. We find that in doing so, they often adopt healthier behaviors, which is important, and they experience a better quality of life. Okay, this isn't working here. Let's see here. So we are a nonprofit, a private agency serving older adults in Madison. I actually came to be from the formation. The formation came to be from 4 other unique organizations that have been a part of Madison for decades, for 50 years. And these are the 4 organizations that joined together to form Newbridge. I'm not sure why this slide isn't working here. Let's see here, 1 second. Let's see. It's not. Just 1 moment, I apologize. Just trying to get it to play, and it's not wanting to do that. Let's see here. Okay, maybe now we'll do it.
There it is.
There we go. Okay. So I'm going to just briefly kind of talk about some of the programs that we have. Unfortunately, you know, we live in a culture that really doesn't always recognize or value the contributions of older people. And so it's important, I believe, to begin to reframe aging. You know, and that starts with doing away with disempowering words that tend to stoke stereotypes like elderly and senior. Instead, we try using inclusive language like older people or older adults. And it really is actually now the preferred term for those folks over the age of 60, like me. So we have case management services. Our case managers work with clients, sometimes along with their families and their other professionals, to kind of assess the needs that they have, connect them with appropriate resources, provide ongoing assistance. In 2021, our case managers actually served over 1,500 clients, and we helped almost 100 clients with their Medicare D plan review, and we saved them close to $200,000. That's big. And of course, during COVID-19, our case manager intake line was very, very busy, understandably, and they answered almost 2,500 helpline calls from older adults in the community who were not sure what was going on with COVID, not sure what to do, not sure where to go, not sure, they weren't sure of much. Many were very isolated in their homes and socially disengaged. They had health issues, both physical and mental. And of course, those were often made worse by the pandemic. So that helpline that we had really helped folks in the community. In fact, we work with older adults 60 and older across Dane County. Free service to eligible Madison and Monona older adults. Eligibility means 240% below the poverty level, or under $2,700 a month. And we also serve older adults 50 and older who have Medicaid. We have bilingual case managers available, and they can actually serve anyone residing anywhere in the county. We have our diversity in it. Well, I'm going to come back to this diversity and inclusion. We're going to talk about some of the other things. We have Bridge Buddies, which is really important to older adults. It started during COVID, actually, provides social contact with volunteers making weekly calls to kind of just check in with folks, make sure that they're okay. And often they really end up developing lifelong friendships, which is really nice. Our food bridge basically is making food deliveries. We make food deliveries depending upon the person. It could be weekly, it could be monthly, and it's food pantry deliveries to folks who often can't get out on their own to get groceries. And nutrition sites. We have 12 nutrition sites, soon to be 13. Very proud that we are now going to be collaborating with the Boys and Girls Club in South Madison on Taft Street, and we'll be providing nutritious meals to older adults beginning in the fall. We provide transportation there. They just have a great meal. Again, it's a free service to older adults in our community. Our home chore program helps older adults. It's, as you get older, sometimes you get some aches and pains and you just don't feel like cleaning up your house. So we offer cleaning and decluttering and organizing. We also offer for our older adults who are homeowners, we offer outside services like raking, weed pulling. Who likes to do that, right? And snow plowing and also snow shoveling. We also have a loan closet, really important to health, because as folks age, sometimes there are mobility issues or health issues. So we have a loan closet where we have wheelchairs and canes and walkers and shower chairs. Recently, I gave out a lot of in fact, we're getting ready to start a program, I'm hoping, to give blood pressure cuffs free of charge to older adults, because we really try to empower the older adult to kind of take part in their own health, and be their own advocate. So that's really important. Our loan closet, we ask that when you don't have a need for the item any longer, that you just return it. But again, these are all free services offered to older adults. This says food clinic, it should say foot clinic. Very important, especially to a lot of our older adults who have diabetes. They are free clinics. They are all over the city of Madison. And I think it's something pretty important that we do. We have classes and activities. Now, generally, our classes and activities, we try to focus on health and health disparities, especially when you're looking at Black and Spanish speaking older adults. So we have classes on diabetes, we have classes on hypertension, we have classes and programs around dementia and Alzheimer's. We have, and I'll talk more about a specific program that we have. Probably, sometimes 30 or 40 people show up every Thursday for a program that I call the ThinkCap Cafe. And we also have spring and summer concerts. So it's not all about education. Sometimes we just have fun. We have a concert coming up next May. Actually, we're going to start a spring concert, and it's going to be right in the center of South Madison, where we very seldom have activities and programs. It's going to be at a park called Penn Park. We have a group by the name of Kinfolk, and we're inviting, this is going to be a multi-generational event. A lot of dancing, we'll have food carts. And so it's really important, as we talk about health, to also talk about the social aspect of health, which is really important as we age. We have collaborated, and we couldn't do this work certainly without the collaboration of many organizations in the community, the ADRC. We also work with the Urban League of Greater Madison, with the African American Opioid Coalition, the Alzheimer's and Dementia Alliance of Wisconsin, the Latino Academy. Many of our health organizations have been very, very good to work with. MSCR, local churches, of course, are focal points, of which there are 11 other focal points. The interesting thing I found out yesterday about our other focal points is that the other focal points aren't diverse. So we're actually trying to work with them to create a little more diversity in terms of their programming and also in terms of just the folks who are working at these other focal points. We're doing a program with Arts and Us. We do Madison Public Library, some of the Black sororities and fraternities. So my point is that it's really important in this work to collaborate with other partners in the community. And we're just really pleased and honored that we are able to do that. Of course, the African American Health Network and various UW-Madison departments as well. I'm going to focus now on our diversity and inclusion program. We really try to focus on health, but we all know that health is not just about disease and health outcomes. It's also about kind of your cognitive development. And a lot of that can come from socialization. So during the month of February, of course, we do a lot for Black History Month. We had a really special program with Venus Washington, Black Girl Magic Yoga. And so we had folks who did exercises. Everything, of course, has to be offered virtually now, but we do provide laptops free of charge to older adults as long as you are 60 years old or older and you need a laptop to join programming. We will give you a laptop. They're great laptops. Again, it's another collaboration with Epic. We get laptops from them every year. They're really good. We put Zoom on them already, so that the camera is right there. And we also provide support, technical support, because many of our older adults have never used a computer. So these are just some of the programs that we have worked on over the past year or so. A lot of music programs. Our very own Leo Stanley had a wonderful program, and a lot of folks attended and just kind of lifted their spirits, especially during COVID. And it's really just warms your heart to see our older adults get on the screen, many for the first time using a laptop, and just to see how they enjoy that socialization and that camaraderie and engagement with other folks. Really, really good to their mental health. We had a paint and sip party with artist Linda Mathis. Again, just lots of fun, lots of engagement. We do a lot of different, once a month, actually, we try to do a paint night where folks get on screen and we provide them with all the materials they need. We also, again, focusing on health, we talk about food and how we can eat healthier. We did a heart healthier soul food dinner where we used vegan butter, and we used, and it was okay. It was kind of tasty. I don't know if it was quite as good as cooking it the regular way, but we used monk fruit instead of regular sugar. So it was, and we had these all delivered, again, by the help of some of our collaborations. I think it was the Madison Urban League that provided volunteers that actually delivered to, at that time, I think about 80 older adults that requested dinner. And then we do a Black Film Friday. We come together again on Zoom. We provide the popcorn. We have popcorn delivered to everyone's home, and we enjoy a movie on Fridays. And a lot of this started during COVID because we found that it was really important to kind of connect folks. We do bingo. Bingo now is every month. We give out $25 and $50 gift cards to Walmart, to Walgreens, to Target. That is an incentive, of course, for people to play, but it's very well attended every month. And it's, again, just a nice time for folks to socialize and come together. And a lot of times they're seeing friends who are old friends who they haven't seen because of COVID, or they're meeting new friends. And we do a bilingual bingo as well. Lots of program. We just hired a person who is working with our Spanish speaking or Hispanic. And we're actually changing our terminology there. We have been saying Latinx. I've been saying Latinx for the 2 years I've been a part of Newbridge, but was recently told that really is not the term to use. So we are really now trying to look at a lot of our publications, a lot of our literature, and change that to Hispanic and or Spanish speaking. And as Carla was mentioning, COVID. Like, we had several COVID conversations during the past couple of years. Very important to get health professionals who look like them to talk about COVID, to talk about the vaccine, to talk about the virus. And folks who are trusted in the community came together, and we just, it was just really important because there were a lot of questions. And I'll tell you, there are a lot of older adults that I work with who still are not on board with being vaccinated. So it's just, it's still really important. We know that it's still there. Yes, the numbers may be lower right now, but it is still there with this new variant, subvariant. And so this conversation continues. As I mentioned before, every month we do something that is specific to address health disparities, specifically in the Black community. So we did a connection between diabetes, kidney disease, and high blood pressure, because a lot of folks don't realize how those are, that intersection between those three things. So that was really a well-attended event. And then we do things that are just kind of programs where we invite the community in. This was a program, we actually did this twice with Sarah Collins Rudolph, who of course was what she calls herself the fifth little girl. She was actually in the basement bathroom in 1963, the 16th Street Baptist Church bathroom, where her sister, Addie, and 3 of her friends were killed by the KKK. So that was just a wonderful presentation from her. And again, all of this is just to kind of get folks together. We do some type of music every month. That this particular month in April, of course, was Jazz Appreciation Month. So Marcus Click came on Zoom and performed an hour-and-a-half concert for older adults. But it wasn't just for older adults. A lot of time we invite the community in. We have safe spaces, a Black space where older adults come and talk about issues that are important to them pertaining to race. We also, we do one in Spanish. We do lots of exercise classes, because we all know how important exercise is to health. And we work along this. Get Moving on Zoom is offered through Fabu Carter at the university. So it's a great collaborative effort. And the Think Cap Cafe, this has become kind of, you know, we do it every week. We were doing it every week. And I said, you know what, let's just do it every month. And the participants said, no, we really want to do it every week. It's our time. Every Thursday at 11, we look forward to joining with the other older adults, and we do brain engaging activities. We're trying to either ward off or lessen the cognitive decline that can happen as you age. And it's really just a fun group of folks that get together. And I'm talking right now, maybe 30 or 40 people on a regular basis to socialize and connect with other older adults and engage. And of course, May is coming up, and we have lots of stuff coming up. We as you can see here, we really try to, like every month I look at what's going on. And these are the things that are going on in May that we will be having some type of program around. And that will be, we did a tea party last year that we will be doing every year now, where I invite people to kind of wear their fanciest hat, their most favorite fancy hat. And I have tea delivered and cookies delivered and gift bags delivered. And we get together, and we had a DJ come, a friend of mine from Philadelphia, who played songs all about mothers, which is really fun. And again, it's all just to help socialize, to help their mental state. We have future programming coming up that we're looking forward to. We have on the 12th, actually on Saturday, advanced care planning, engaging the Black community. And these are just some of the things that we are looking forward to presenting and being involved in our Black older adults specifically. Okay. The Grandmothers Project, the Diabetes Peer Training Program, is, of course, with our wonderful Dr. Eva Vivian. And we're going to be doing a program on the C word, because many folks, a lot of, and I will say a lot of our older adults have been diagnosed with cancer. And that we're going to come together and kind of talk about it, talk about the C word, because a lot of folks in our community are kind of hush hush about that. And we think that it's really important to kind of engage with other folks so that they can kind of learn about some of these health issues. And that's it. Again, I'm Dina Wright, Diversity and Inclusion Manager at Newbridge. And if there are any questions, I guess our our wonderful moderator, Miss Gail, will try to pull those up in this chat. And thank you so much. I really appreciate it. Was trying to keep track of my time here. And again, thank you so much for inviting us and inviting me to take part.
Dina, thank you so much. As I said earlier, we all benefit from education. This was just wonderful information that you shared. I do have to say, we really only have about 1 minute left. I believe, or do we go to 11:15? Okay, okay, so we go to 11:15. So it is 11. No, okay, so we have, so it is, now it is 11 a.m. I know we have a couple of questions. Let's see.
I have a comment.
I know I saw some comments. I don't remember seeing any questions. So if you do have a question, we do have a few minutes for our panelists.
Gail, may I make a comment?
Yes, please. Go ahead.
Hi, as a faculty member at UW-Madison, as well as the president of the African American Health Network, I have to say that when people ask me what's the favorite part of my job, it's engaging with the community. I've learned so much from working with the community. And what I would encourage all researchers to do, learn more about the community. Today, you heard two incredible presentations from Carla Gaines and Dina Wright. Carla discussed the approach that was taken to address vaccine hesitancy in the African American community and how she collaborated with other trusted messengers to actually reach those who needed the information to make an informed decision about whether or not they wanted to become vaccinated. Dina Wright's activities at Newbridge are absolutely incredible. And sometimes we as researchers come up with these ideas and we don't even realize that the community is already addressing these issues. So get to know the community, maybe talk to Dina Wright and find out what she's currently doing at Newbridge and find out what are the needs of the community before we go in all guns ready to shoot and come up with our own agenda, when in fact the community has a different view of what their needs are. So it's been a pleasure holding this again this year, and I'm just so pleased with the presentations that were given today. And I encourage all of you to obtain Carla and Dina's information so that you can share it with some of your colleagues going forward. Thank you very much. These were wonderful presentations.
We thank you, Dr. Vivian. We do have a question. Dina, can you go over the 4 components again? Dina, you have to unmute yourself.
There we go. Let's try this again, right?
Okay.
So the 4 characteristics of aging, and we say successful aging, but I also like to kind of say joyful aging. And I break it down, as I said, into 4 categories. 1, a low probability of disease and disease-related disability. 2 would be high cognitive and physical function capacity. 3 would be emotional vitality. And the 4th one would be active engagement with life. So we really try to encourage, folks being an active participant in their lives. There's really a lot of, I work with folks who are homebound or folks who have, issues with mobility, but there's so much they can still do. They can still be active in life. That active is defined differently, of course, depending upon your health, depending upon your mobility. But those are the main 4 categories. And, we really hope to have all 4, but sometimes we don't, and that's okay.
And let me just say that Carla, Dr. Vivian, and Dina talked about the importance of, working in and with communities. And that's one of the things that I tell people, that with respect to what I do, that's one of the things I love. And so one of the things that really threw me, especially in the early days of the pandemic, because I'm so used to being on the road, going to, the different 5 public health regions in the state. I'm also accustomed to, from time to time, going to national meetings. And a lot of times, especially when I'm traveling in the state, it's because a community organization or a faith-based organization has said, can you come and talk to us or whatever? And I love doing that because, again, we learn from each other, okay? Yeah. And I tell people one of the best parts of my job is when people, especially from the community, contact me and say, can you come and do this? Or do you have these? Or do you know where? It's like, okay, folks, and especially in the African-American community, because it's very important to realize that, when you look at all of the statistics in terms of disparities and all of that, it's like, oh boy, you can really get, depressed. But I tell people, I don't care what's going on in the community, how challenging the community is. There are trusted people in the community and trusted organizations that people go to. I always tell the story about when George Floyd died, and a gentleman from the community in the Minneapolis-St. Paul area was being interviewed by National News Service. And he said, finally, they asked him some questions, and he said, well, I have to go. And he explained that he had to go because there was an older lady in the community who needed some medication, and the pharmacy was not available. Now, this gentleman was not a pharmacist. He didn't own a pharmacist, but she knew to call him because she knew by calling him, he could help her. And that's the thing that we need to remember. That's one of the things that we need to remember about working with communities. There are folks that people will call on, and they will call you for some of everything, okay? And I personally consider it a blessing because this is the way I tell people, I don't know everything, but I sure know a lot of people. So if I don't know who to call, if I don't know something, I know who to call. All right.
Let me just share this. When you said,
yes,
there is a particular older adult that literally will call me 4 or 5 times a day. I have learned now not to answer every call, especially there at night. But now that he has learned his laptop and how to email, every day, morning, noon, and night, I get his blood pressure readings because I have given him so he's now using it. And, we have been talking about his medications. I have given him a list of questions to ask his primary care physician. We have had a conference call with him. I'm no doctor, but I know some stuff about and we have now gotten him off of a medication that I thought he should not be on because his blood pressure was not being controlled. He's now on amlodipine. And he's so happy. And now that he is a part of his own health journey, you just what that can do for someone. So yes. He sends me his blood pressure. I mean, it's unreal. So you're right. And I think, and it's a blessing. And, sometimes I feel like, oh my God, here it is, such and such calling again. But I'm so happy that he feels good about his health now. He says, oh, my numbers are good today. And it just warms your heart. Yeah.
I saw a question in the chat, Gail, regarding COVID numbers.
Yes.
Definitely. DHS.gov has awesome data. It comes out every week. But in Dane County, currently we are at that low in Dane County. We've had about I think in the white community about 83 to almost 90% 2-dose vaccination. However, in the Black community, it's only like 33% that have been vaccinated. So as you can see, our work is still ongoing. I just spoke with one of like Dina. I get calls too. I just got my second booster, matter of fact, the other day. And he was waiting on his healthcare institution because he said, well, I got it there all the time, and I have Pfizer, and I want to make sure I get Pfizer, and he has cancer. He's in treatment. And I said, you are immune compromised. You don't need to wait. Go call Walgreens. You can get an appointment today. And so that's what he did. He said he got his appointment, and now he's gotten his second booster. And so when Dina talked about, we all are those faces in the community that people call. And like Gail said, if we don't know it, trust me, we know somebody that does know it, that knows somebody that knows it. So that's what that networking and community partnership collaboration is so important and so much about. And again, I have to put a plug in to the African American Health Network, which we all are involved in. Gail and I can't remember, it's been that long, Gail, but one of the originators of African American Health Network. But Dr. Eva Vivian saw the need to rebirth it, get it back going. And I tell you, we have been running ever since. And we have decided to do our Be Black, Be Strong event to kick off Black History Month. We are the ones that need to do that, because we are the ones that are helping our community with all of this information. We have members from all walks on our organization, which is so critical and important. And that program was incredible, totally incredible. So I'm excited. Thank you for letting me join today for the first time. I learned a lot. I'm gonna stop talking, Gail, see if there's any more questions.
I did not see any additional questions, and I think we have about another 2 minutes. Dr. Vivian? Oh,
Yeah,
I don't.
Gail, there are actually 2 questions in the
Oh,
Q&A box, and
I'm
they're
sorry.
both great. Yeah.
Okay. Okay, I can't see them.
Dr. Gill, I can see them. I'll read
Okay.
the first one, thank you all for sharing your wonderful work. Question for Dina. Can you please elaborate on why is cancer and especially sensitive more so than other chronic illnesses in Newbridge community?
Unmute.
Well, sorry, why is cancer, what was that question?
Why is cancer and especially sensitive more so than other chronic illnesses in the Newbridge community?
Yeah, so, it's not, so the community that I'm talking about is the Black community, our Black older adults. I don't know that it's more sensitive, but it certainly is a topic that is more hush hush. Many folks who have cancer just are trying to keep it private.
Right.
And so we find that as folks begin to start to talk about it, they find other older adults who have it, or maybe they're in remission. And so I don't know if it's, I think it's just in the Black community. A lot of folks are just very private and they don't discuss health issues. But, listen, we had a conversation the other day with some Black women, older Black women, who were talking about Pap smears and pelvic exams, and they were over 60. 9 out of 10, there were probably 25 in this meeting, said that their doctors told them they no longer need a pelvic exam. And I said, I was told that too. Well, then one lady said, well, you know what? I just had a pelvic exam and I just found out I have 4th stage cancer. And so for me, who was leading this program, I immediately called my doctor and I said, I need an appointment. I want to because I hadn't seen my gynecologist for a while. I'm going to be 65 in July. And so I immediately went in because I still have my ovaries. I had a hysterectomy some years ago. And so I was told because of that, I didn't need that. But I don't know that that was factual information. So because of that conversation that with these 24 women, people are now going in and getting, and listen, so one person I just got a call from yesterday guess what? She has to have a biopsy because they think they may see something. So these conversations are so, so important. I actually went in, I requested a ultrasound of my ovaries. You know, little did I know your ovaries shrink when you get older. I knew they did, but I didn't know how much, like a half of an inch. And so anyway, so these conversations are so, so important to share. And many times in the Black community, and especially as folks get older and they're kind of set in their ways in terms of, oh, I'm not going to talk about my health. So cancer is one of those things that people just don't talk about. They don't share. You know, I mean, look at celebrities. We didn't find out that Chadwick Boseman had cancer until he was gone. So yeah, that's all I would say on that, that it's just private and it's not just cancer, but that's a big deal for the Black community in terms of health disparities. And so we're going to address it. We're going to have a program. We're going to have some health professionals come in. I'll tell you what's been hard though, is to find health professionals who are Black to come in and talk about cancer. And we're talking about some of the experiences that people have had at the UW Cancer, at the UW Carbone Cancer Center. Some of the Black women have gone there, have had awful experiences. We now are working with them to try to make sure that doesn't happen to other folks. So yeah, these conversations, just talking about things is really important, and cancer is one of the big things. Yeah.
Gail, the last question was really regarding depression, disparities in the healthcare, but do we also work on maternal and infant health in the Black community, and what some practical strategies for helping with these issues? And I would answer this question is we again partner with the Foundation for Black Women's Wellness, who's doing a whole lot of work in this area in maternal and infant health. And I would have this Melissa to reach out to the Foundation of Black Women's Wellness. There's going to be a maternal health conference April 21st. Please get on the website, Saving Our Babies, and sign up for that website. It's April. It's that summit is going to be April the 21st.
I think we're out of time now.
Yeah, I was just going to say thank you so much for this panel. Really appreciate you making transparent all the partnerships and logistical things that have been happening during COVID to combat the disparities that you were discussing, but also that one of the themes of this conference is also rebuilding and thinking about hope, resistance, and community as constant threads in part of this. So I also appreciate you just highlighting all of that and how that's ever present in all of the work. Everything looks amazing. Thank you so much for joining us again today. I really appreciate it. And this just felt like a really urgent and timely conversation. So I appreciate you spending your Saturday talking with us. I really appreciate the audience for joining us and being so interactive. In 12 minutes, we have another round of concurrent sessions, and then we have a performative piece and a collaborative artist network speaking for our closing session today. So there are more community-based sessions to engage with. I appreciate everybody. Gail, thank you for doing the virtual moderation. Hopefully next year I can get the in-person, but it went great. All the slides were lovely, and it went really well. So thank you so much. And I'm gonna hop on my next session, but it was great to see everybody, and I appreciate your time. Thank you.
Bye-bye. Thank you.